Right now, many parents are struggling with the decision on whether to send their children to traditional and classroom instruction or select a virtual option for their children. Dr. David Ansardi, the biology chair at Calhoun Community College, joins us now to talk more about the issue. Thank you so much for being with us tonight.
Thank you for having me on again.
First off, there have been recent reports that a person's blood type may play a role in their likelihood to get the coronavirus and the severity of symptoms they may experience. Is that the case? And if so, what do we know so far?
Yeah, I've seen more than one report about that. So it looks like there may be some increasing evidence that if you have type O blood, you may not be as likely to develop severe COVID infection. Those results are still new. It's still being looked at really carefully, and hopefully there'll be some more information going forward. But and I want to say, in biology with things like this, hardly anything is ever 100% black and white. So if you have type O blood, that doesn't mean that you have no risk of developing severe COVID infection. If you don't have type O blood, that doesn't mean if you become infected, you're doomed to having a really severe case. It's just, it may be if you have type O blood, you are at least a little less likely to develop a severe type of response to the virus. But hopefully more info will be coming out about that soon.
From a biology perspective, do we know, are children really less likely to get coronavirus or just less likely to show symptoms?
With this virus being so new, and there are things that are being researched really rapidly that ordinarily would take years to study with a virus. So some of this information is going to continue to fluctuate over time, but it appears that children are at least certainly less likely to have complications from COVID-19. So if they do get it, they're going to have a mild case. They probably are at least more likely to be asymptomatic, not have symptoms. And I know there is some school of thought out there, well, it could be that especially young children under 10 or maybe even a little bit younger, a number of them may not even really be capable of being infected. And in that case, maybe they can't transmit to other people. But it's still a little bit too early to make definitive statements like that. So again, hopefully, as with the other issue with the blood type, hopefully more information will be coming forward as we continue to do more research.
It seems reopening schools has risks regardless of how you look at it. If experts like yourself could implement an ideal plan, what would it look like?
Well, that's a tough one. And I really feel for the school administrators at all levels who are in this position of trying to come up with a plan, because I know it is difficult, but what all the health experts keep telling us is probably a case of, if you can keep your child at home, you're capable of handling the homeschooling or the virtual education aspects at home. That would be good, not only to protect your child and your family, but also it will limit the number of children who are in the classroom, which fewer numbers, less crowding in the classroom will always be better for everybody. So I think that's important, in my opinion. And also in the schools, man, I know it's going to be challenging, but those things that we hear about social distancing, trying to keep people spread out at least 6 feet apart, and mask wearing looks like it really has a substantial effect on limiting transmission of the virus from people who have it to others.
Anything else that you would like to share with families tonight?
Ignore conspiracy theories on social media. There are way too many of those types of things being circulated around. Try to stick to factual information that's coming from the medical experts out there, our doctors and our nurses. I have a lot of former nursing students. I haven't seen even one of my former nursing students who, I have former students who are nurses. I'm not a nursing instructor, but I have former students, lots of them, who are nurses. My daughter is a nurse down in Pensacola, and I can assure you that none of these people are telling me that COVID-19 is not a big deal. They're all saying it is a very big deal, and we want to continue to take it seriously. So please ignore the conspiracy theories. Our hospitals are filling up. People are dying. It is a very serious type thing. Ignore that. We've all got to come together as a country. If we're going to get through this, we've all got to come together and take the steps to reduce the spread of this virus. It'll reduce the burden on our healthcare system. It'll keep our hospitals from overfilling with patients and our ICUs from overfilling. And, we don't want our healthcare system to become so stressed that we don't have adequate care for all of the COVID patients and everybody else. So to do that, we need to make sure when we are out, we are wearing masks and social distancing.
Dr. David Ansardi, biology chair at Calhoun Community College, thank you so much for your time and your insight tonight. We really appreciate you.
All right, thank you very much. I appreciate it.